Okay, moving along, we are now looking at the Environmental Public Health Tracking Network. So if you were to just do a Google search, it will give you a link to this. It's run by the Centers for Disease Control and Prevention. So CDC provides it. So there's the web link up there. The Explore Data feature is the part that a lot of people like to go to. You can view data on a map, and you can also view data by downloading it and then doing some sort of analysis or comparison. They even got a COVID-19 mapper on here now. So environmental justice as a mapper, we can pick on it and look at internet access, environmental quality index. We can select a measure for that, like water in the water domain, or we can just leave it open. We'll just leave it. We'll try the water domain. We can look at state by county. And it'll do it individual states, or we can do national by county. We'll do all the years that their data were provided. This is pretty old data, though. It's almost a decade old, but it's better than nothing, and we can tell it to go. So I'm not for sure exactly how they developed the Environmental Quality Index, but you can see that in terms of this water domain, this area is the worst. Low index scores are bad. Things that are in the things in the red, the low index scores indicate higher. Okay, so things in the blue, it must be pretty good. Things in the red are pretty bad. This must relate to let's see, low index scores equals higher environmental quality. So these areas, it's saying is high environmental quality, and higher index scores mean lower environmental quality. But this is in what's called the water domain, I think, but I'm not 100% sure because I know, like as we're even talking today, Jackson, Mississippi is having some serious problems with their public water system, and they've been having those problems for quite some time. But there are other ones other than the Environmental Quality Index. We can look at Social Vulnerability Index, and we'll do socioeconomic, national by county, all counties. And we'll even look at 2018 and see how this performs. And as we do so, it'll help make sense of our map. So this dark blue is actually the areas with the worst. We got that kind of information. So very helpful information in that regard. We can go back and explore the data using different environmental measures at the county level. You can download this data from the system at the county level. I don't know how common the birth defects data are, but this is all a lot of new information's been added in here. So this is the percent with spina bifida, select measure, average number of cases will be prevalence, which is adjusted for population size. And they got state by county, and state by county data smoothed, where they're actually estimating it. And we have to tell it which state we're going to look at, and we'll tell it to look at Kentucky from 2015 to 2019, and we're letting it show us all ages and groups. You see a clustering in this data for the center of the state, and that could be because those are areas where there's a high enough population to get some counts. And then eastern Kentucky looks like there's relatively none, but the prevalence in these counties, including Madison County, is about 3.58 cases per 10,000. I don't know how that compares to the rest of the nation. So some people will use the Environmental Public Health Tracking Network to view the national data on any particular topic, and then draw inferences based upon other county or local data related to air pollution. So here is one called biomonitoring, and they've got some biomonitoring data. I don't know how many they've got for the country, but disinfection byproducts in the blood 2011 to 2014, all years. There's no map, so I don't know what this is gonna do. It may not tell us anything. It's just a map, so not particularly helpful there. They have other ones though, where when you're starting to look at some of the drinking water indicators or heat or asthma, things that are more common, you can access it for a lot of the country. So with water, we'll look at the disinfection byproducts, which are cancer-causing chemicals that are in the water. And we'll look at the annual mean concentration. We'll go to the national by county, all counties, and we'll even look at 2020, for example. And we can do the maximum contaminant level less than or equal to MCL, or we can pick on the ones that are greater than MCL, and then there are the ones where there was not detected, but we'll just do those two and see how it shows up on the map. So here are the areas where in 2020 there were communities that exceeded the maximum contaminant level for that, and yeah, so but they pretty much detected it, looks like, since there's no green dots, pretty much everywhere, but very, very low concentrations. So you can use that information, play around with it. There's a lot of other information that's contained in there. So that's the Environmental Public Health Tracking Network. Kentucky has their own. We have our own for the state of Kentucky. It's actually called EnviroHealthLink, if I remember right, .org, and it's run out of the University of Kentucky's website, if it's still active. And here it is. So and they also have a way of downloading data. It's got a little bit more resolution than what the national map has. By Kentucky having this system, it helps Kentucky get information into the national system. So you can look at water quality, for example. We'll look at disinfection byproducts again. Annual mean, we'll do trihalomethanes. We agree to use this. Geographic area, we'll do it at the county level. Year 2018. We can have it display it by geographic area. We can download it. All those things are possible. So here are the trihalomethane maximum contaminant level is 80. Here they are for Kentucky from the year 2017. So you can actually, a lot of them, nothing detected. Overall in 2017, only one of them exceeded it. 80 was the max. So that's just one of the many variables that are in this particular system. That's for those. We could look at other things. Not a whole lot on water, but there's also injuries, hospital discharges. Some of the data may be older, so injury mortality, age-adjusted rates, you know, geographic area. I think you can do a lot here with it if you wanted to. So I'm not going to spend too much time on here. This is the statewide injury deaths per 100,000 people. Number of injury deaths, 4,000 in 2017. You might be able to break this down at the county level if you dig further. So that's the Public Health Tracking Network. There's the local one, which is the state level, and then there's the national one.